There's this video that has been trending online about what happened at FMC Jabi in Abuja. And of course, as usual, when videos trend, you hear different people with different opinions.
Yep.
However, the question you must ask yourself, this opinion, is it unbiased and is it fair? I can tell you for sure, we are ready to give you an unbiased opinion. So we are going to examine every detail and every bit of the things that happened in that video, the things that you did not even observe. We are going to dissect, and then at the end of everything, we'll see what our conclusions will turn out to be. So let's watch the video.
People, they should bring out the patient. I just see them on the road, carry them. You say people, they should bring out the patient. See what you are saying. It's not. You said people, they should bring it. You, what are you doing? You don't understand what? I have already bring the patient here. Do you want me to do your work? What are you saying? Oh, it's not your work.
Who is this lady? Who is this lady? So basically, you have someone, a good Samaritan, who has brought a patient to the hospital. Okay? And you can already tell that something must have transpired before he started making this video.
Yeah.
So he didn't start making the video immediately he got to the hospital because of course he didn't know what was going to happen. He didn't know what the response of the healthcare providers would be. So something must have happened. So apparently, from what we can see,
there's some back and forth.
Yes, some back and forth. Yes, some back and forth. We don't know those things. We don't know exactly what happened. Now, this lady, initially I was thinking it was a doctor, but I think maybe a nurse.
We can't see the tags.
I can't see the tags.
So it's difficult to tell, you know. Anybody can wear scrolls. Is either a nurse or a doctor at the emergency.
Yes. So basically, it could be because most times at the emergency, you know the way the emergencies run, especially in Nigeria, the nurse is the first person that they see.
In most places.
And of course, the doctor too is supposed to be at the forefront. I mean, the doctor should be at the front desk. So once they call the nurse and say, oh, there's this emergency outside, the nurse says, oh, doc. But the only thing I noticed that in this video, I didn't see any other person that probably looked like a doctor except for one guy sitting inside. So maybe this was the nurse.
Anyway, we don't know. No, it doesn't matter whether a nurse or a doctor.
So we continue the video.
You are on camera. You are on camera. You are saying that I'm recording you. What nonsense? I just assist some people.
All right. So another point to note here is that it wasn't an hidden recording.
Okay.
So it's not like the guy was recording in secret and then she didn't know. It was clear because he told her he was recording. So that is also very important.
People are nearly dying. I just asked them. He said, can't you call them? See how this guy, see his situation. See his situation. It's something that you are on record, so you are on record. I just see some people on the road. I just assist them. You are saying that. Must you open the car? It's open.
Where is what's his name? Elijah.
Probably calling out for the porters.
Yes, she's calling out for the porters. So you see, again, I'm wondering if before the video was started, she might have examined the man. Did she? Because it's at this point I'm seeing them open the door to the vehicle. Is it that they had examined the man before? Because it would be worse if they had not even seen the patient at all.
Before all the brouhaha started.
So I mean, the patient is dying in the car, but you're arguing outside. You know, and in one of our videos we've talked about I know in Nigeria we shout a lot. You know, somebody came to Nigeria from another African country some years ago. I was telling me, are you Nigerian? You shout too much. Everybody just, are they angry? That when she heard people talking, she said, this guy must be angry. But then they now told her, no, that's just the way we speak. We are not angry.
We are not angry.
Because if you look at this back and forth now, you brought the patient to the hospital, and all we are hearing is, no, you must take the patient. I brought him. You know, it's not supposed to be like that. The other one to be saying, no, I can't do this, I can't do that. If this were to have happened in a developed country, their voices won't be like that. Oh. Their voices are never, even when a white man is angry, they don't talk like that. Okay, so maybe that's the way we talk. Let's continue the video.
That's who we are.
That's who we are.
Him die inside the car. No, my sister, I've already did my best for me to see some people there and bring them to hospital. She's saying she's not my distance. It's not
my duty.
Clear. It's clear. Actually, in all honesty, the man tried. Because it's not easy for you to see a patient who needs medical care and for you to put the patient in your car.
Yeah.
And bring the patient to the hospital. But we said this is an unbiased review. This would never happen in a system that works. A passerby will never be required to put a patient in his car. So that already tells you there's a failure.
There's a problem.
Because you see that man, if he has a spinal cord injury, that man is totally dead because they just put him in the car.
Someone that is not trained on how to carry, a patient.
Yeah, so
the way they carried the way they carried the man might have even caused the man more harm.
The way the man appears,
more harm than good.
The way the man appears in the video, of course, there were no precautions in carrying him. So the Samaritan has tried. We give him 100% for effort.
Yeah.
But when people are blaming the healthcare providers and hospitals, you should remember that the primary problem here is the failure of government. Because there are no emergency services.
Systemic failure.
There are no EMRs. There's no emergency response from the scene of the accident. So how come everybody is now shouting at the hospital? We are going to come to the blame of this. Don't think that we are trying to say the hospital has no blame.
We are looking at every point, every stage in this case scenario.
Yes.
What were the problems? So we are going to get to the hospital level and all that.
Yeah. So while you are shouting at the hospital, remember that it is your government that has not provided those things.
Any abroad, good Samaritans, people are well trained on how, or at least have some basic training on how to handle injured patients, or basic training on cardiopulmonary resuscitation, things like that. To call, how to ask for help, that will not cause more harm to the person you're trying to help.
Yeah. So that will not cause more harm is very important, because most of the time what they do is you put the patient in a safe position, recovery position, and call for help. You don't carry that patient. You don't see a patient under a truck, for example, in an accident, and you quickly go and remove the truck of the person. The person is going to die.
Exactly.
So you wait for the emergency rescue to come. All right, so let's get it clear. That's a government problem making this man to bring the patient to the hospital by himself. So let's continue the video.
If it is your relative, can you leave him the way?
But look at the way everybody's just standing. There is an emergency and people are just complacent, just standing, looking like, okay.
So what? I mean, this is almost like I don't know how to describe it. There's an emergency. Somebody is in the car, and in fact, even if you want to pretend.
All hands are on deck.
This one, all hands are in the pocket or what?
God have mercy.
So this is quite bad. This is quite bad on every level. You cannot have an emergency and you just have this lackadaisical attitude about it.
Yes.
That's not good. All right. So.
Minister of FCT.
So even if it's something you can't handle, you should be seen being proactive.
Yeah.
You said there's no hand glove.
No gloves.
You said
no gloves.
I just no problem. No.
See someone seated.
So someone is seated. So this guy is probably a doctor.
You said there's no.
Well, we don't even know who that person is. Are you sure?
Yeah, so now you see there are no gloves. We can't hide the truth. The truth is that there were no gloves.
It happens. We have worked in government hospitals.
So when there's this memo that's come out where the hospital says there are gloves. Of course, there are gloves in the store now. Are we saying there are no gloves in the emergency store? But there are no gloves out there. Sometimes they tell the patient to go and buy gloves.
It's possible there's an emergency, and then that's at the time you're writing
gloves.
Go and buy gloves.
Yes.
Yeah, and it happens. These are things we've worked in government hospitals. We have worked in some private facilities also. No gloves.
So they were not lying. There were no gloves. It was obvious there were no gloves. Okay, so let's continue the video.
Let him die there. I am on the video because there's no way. Yes.
Yes. So now this is the man.
Okay.
Probably at the
he has
head injury.
He has head injury. And I'm going to come back to this head injury issue.
People should bring him out.
See how he's lying in the car.
Nonsense.
Oh my goodness.
General Medical Center. Nonsense. Ask them on emergency unit. I brought a patient. All of them are relaxing. Ask them on emergency unit. I brought a patient. Yes. All of them are relaxing. Nobody will come and pick the patient. Yes, the guy is nearly dying because they say Elisha, minutes. There's nothing like help and carry. I'm here for more than 15 minutes. That's why I'm doing the videos.
Okay, so there's this issue of help and carry. Because of the problems we have in the Nigerian healthcare system, we can't hide. You see, this hospital is a big hospital. I've never been there before, but just from this image of the accidents in an emergency, it's obvious this is a big hospital. However, we know that when patients come to the emergency, many times the healthcare providers require assistance in moving the patients. Especially in this part of the world, we don't have appropriate equipment to lift patients out of ambulances, out of vehicles, and these things affect the backs. If you check many of our older nurses, they have a lot of back problems because they've been carrying patients. So when they say assist us, or they should say it in a nice way, it's not like carry your patient out of the car. No, it is we want to leave the patients, please assist us. So the person should then assist. So it was also wrong for the man to just say, no, I'm not going to carry, because he was already angry. It's wrong for him to have just said, no, it's your business, because it's not just
it's not just their business, it's everybody's business.
So continue.
So let the minister see that if Federal Medical Center there's no staff. That's why I'm doing the videos. You don't have manpower, you don't have staff. No. So let the minister see that if Federal Medical Center there's no staff. Yes. Okay.
So no sense of urgency. No sense of urgency.
And you know the way we behave.
I just see them, they had an accident here. You know, I bring them.
Even if we are grieved that, okay, I don't have the right equipment to work with the personnel, we don't have enough personnel, the way we behave or our attitude when doing, those things can make a lot of difference. We should still show empathy and some sense of understanding, urgency, and all that.
We know that we are not well paid as healthcare professionals, but so far you accept to do the job, because except you are going to say at the end of the month, if they pay you the salary, you are not going to accept it. So far you are still going to accept that salary, you should still do the job as well as you are able to. So don't complain on the job. Do you know how much I'm being paid? But so far you are at that place of assignment. Do the work very well. Do it with the whole of your heart until you get the next job, or until you run away from the country, if you want to run away from the country. But here comes the cavalry.
What are you guys doing?
See them.
What are you guys doing? If you don't have manpower, tell the honorable minister or whosoever.
I wonder who these people are.
All right, so those are the porters.
Where did they suddenly come out from?
You see? So it makes me to feel that there's a lot of comedy happening in this FMC Jabi. I'm sorry to say. If these are the porters, they are not dressed.
Are they passers-by?
They can't be passers-by, because if you see the way they are responding, they know what they are expected to do. So these are the porters of the hospital. Porters are those that carry patients.
Presumed porters.
Because we are not certain. But if you see the way they are talking, it will occur to you that these are likely they are hospital staff. It's not like they just called people. They came and they are ready to do the job, and they know what to do.
And they have gloves.
They have gloves. They came in with gloves, so they had gloves in their pockets.
Okay. So, but where did they suddenly?
They must have gone somewhere else. Is it that they went on another errand?
Okay.
Or
another official errand?
Yes. Or they were just chilling out somewhere. It happens a lot also with porters. You say, because they feel the work they are doing is too much, every opportunity they want to escape. Right? So you see a porter who is supposed to stay there at the emergency, such that when there's any emergency, they don't have to be looking around. You notice that those people were saying, "Where is Elijah?"
Yeah, they were calling a particular name.
Yes, yeah. Because they were looking for the porters. Sometimes you say porters should go and do something. They are supposed to do the thing and come back in 20 minutes. 1 hour, you've not seen them. So you can see that on every level, we have these problems. So let's see what happens next.
Let him die. Bring patient. Bring patient. So let me bring patient. If I bring patient, so let me bring patient. If I bring patient to hospital, you want me to carry the patient, do all the necessary thing for the patient. Okay, no problem. You don't have okay, no problem.
Now to assist with it. Now to assist, then they talk now.
Stand up, come inside.
Not to assist, which there's nothing bad in assisting. You've helped so.
What's this?
Hey, gee, we rewind. Oh my goodness.
Wait though. They are carrying that man on a wheelchair.
Someone with head injury.
They are carrying the man on a wheelchair.
I'm not sure they don't even know the GCS of this patient. They are carrying a wheelchair.
So, for them to be carrying this patient on a wheelchair, it might mean that their trolleys are bad.
Maybe no trolleys or what?
There can be only two options. Is it that the trolleys are bad, or they don't know they are supposed to use a trolley?
Or they don't.
But I don't believe that they should know
they
are supposed to use a trolley here. You can't carry this kind of.
This is the height. This is the height of it.
Yeah, I mean, everything we've been discussing had to do with, there are a lot of factors, but this one is a clear case of incompetence in managing patients. There's no way you will be carrying this patient on a wheelchair. Yeah, and see them lifting.
Well, let's give them a benefit of doubt. They don't have a trolley.
Yes, so if they don't have a trolley, that's another problem, which is why maybe it's good they did the video anyway.
Yeah.
Sometimes trolleys are bad, and there are good trolleys in the store. But I've worked in an emergency, a government emergency hospital, a federal hospital, and they have, when you say trolleys, they have up to 20 trolleys. So why would they say they don't have just one walking trolley when the place should have maybe like 10 trolleys? So it's difficult to understand that or to accept that they don't have trolleys. But I mean, those are the things that they are going to review. Okay.
If they like, let them take care of you. If they like, let them take care of you. If they like, let them allow you. I will not open anything. I just see them on the road. They had an accident. I brought them to hospital. It's an emergency something. So if you like, leave them, let them die. If you like, take care of them. It's an emergency. If you like, don't treat them. And yes, I have already did my best. For me to see them on the road, bring them to the hospital. There's nothing that I can do. I don't know them. No one among them that I know.
Okay, very good.
That's the end of the video.
So that's the end of the video.
Different hospitals have different protocols. I've seen, I've not worked abroad, but I've seen abroad that even, before an emergency lands, they've made calls ahead of time. We're bringing this emergency in. You see doctors, the residents, they're already waiting for the emergency to land. Not nurses in this, doctors in the emergency accepting the patients from the ambulance. We have a long way to go in this country, and from the government to even people, the doctors, the nurses, all the healthcare workers, we have to do better.
All right, so like we said, unbiased, it means that there are many people at fault here, so we are listing them. Number one is the government. Number one, and the government takes most of the blame, because we don't have emergency services and our hospitals are poorly equipped. We don't know exactly the things that happen, but what is clear is that they don't have some basic things in that hospital, even though it's a big hospital.
Yeah.
Now, the next people are at fault are those healthcare providers. I didn't say I don't know if the doctor was there. If the doctor was not there, that would be bad enough, because
Yeah,
it means
we
that
don't
the
even
doctor
know.
was
We
not
can't tell.
on seat. And that's another thing we always say.
Come on,
The
it's come on.
doctor on duty at the emergency
Should
must be
be
there.
at the emergency.
You don't say you're at the emergency and then you are in your
I want to
room.
go and call the doctor.
You want to
I
go and call? No, you
the
can't
doctor.
say you're going to go and call the doctor. Those ones are for cases where you have patients on the ward. If you have patients on the
Stable
ward,
patients.
the doctor has stabilized them. You can go to the call room, or
Yeah.
sometimes even if the lodge is close to the place, you can go there and they will call you.
Yeah.
But in the emergency, you cannot
stand by.
You must be there. It's not like it will take another 10 minutes before they get the doctor out.
Now,
so,
even if there's of course there has to be a call room, restroom, whatever.
Yes.
It has to be inside that same emergency.
Yeah, so what they do is that it's not supposed to be one doctor on duty or in the emergency.
Yes.
So if one doctor is going to rest in the call room, then the other one must
be on the standby.
On standby. Because it's sometimes matter of life and death. 5 minutes patient is dead. So if you are not there, that's useless. So that's on the part of the doctors. On the part of the nurses, you should always be able to patient relations is very, very important. You must be able to if they had communicated well with this person and said, well, thank you very much, you're good Samaritan, very good, you did very well, sir, please, we are going to carry,
we call ophthalmology.
Yes, there's a way you talk to the man that he will be happy. You say,
fantastic, very good Nigerian.
See the man, you bring, even if you can't carry the man yet, you bring pulse oximeter, you bring this fig to measure his blood pressure while he's in the car, because you know the porters are not there yet.
Yes.
So the man would have seen,
trying to buy time for things to be to set.
Yes. The man would have seen that, there's effort. They tried. Not that we can't carry more.
Looking.
So that's on the part of the nurses.
And if you were still going to refer, if you were going to refer at that point, the same being proactive, do the minimum. We can handle. Of course, although this is a government hospital,
and it's a federal medical,
the highest,
yes,
almost the highest form is a tertiary center. So they don't even have the luxury of referring. In quotes.
Like that. Yeah. So at least they will stabilize before referral.
Yeah.
Now, the other problem here are the porters. We have already talked about the porters, so we are not going to go back to that. But you must always be at your duty post and you must be ready to do the job, even though they are paying you 20,000. Porters are very poorly paid, though. If you hear how much they are being paid, you will shake your head. They are very poorly paid. But I mean, so far you take that job, please just do it with the whole of your heart. When you do those jobs with the whole of your heart, you get better jobs and you will be lifted out of poverty. All right.
And for every good Samaritan, you have helped thus far. You can still assist. You can still go a step further. And for health workers generally, I usually say that we should see the people in front of us, the people that need help. If these people were to be my relation, or what would I do? And there's a very thin line between being a healthcare professional and being a patient. Sometimes there's a thin line. So let's do our best.
Yeah. So the other thing I want to talk about now, in the aftermath of this, the hospital has then released a memo trying to say,
as expected,
saying that there were gloves in the hospital. There was this, there was that. That is what you expect. It's Nigeria. They will always put out a face. But the truth is that the way you saw the hospital that day is the way that hospital is. So forget about somebody saying we have gloves. No, there were no gloves. So the question is, where were the gloves?
There were likely no gloves.
If there were gloves, they will not hide. Did you even not hide the gloves? The gloves were likely kept maybe in the store. I've worked in these settings. The gloves will be in the store. There won't be gloves. You go and start looking for somebody to give you gloves, or they write the gloves for somebody. So now the hospital is putting up a bold face instead of them enforcing that all these things should be released free. Now usually there are funds for indigent patients, for especially in federal government centers. So there's usually no excuse for you not to be able to give some little first aid for those patients. Lastly, on the hospital, I learned that from what the hospital brought out, they said they had attended to the patient and the man was discharged the same day.
Okay.
Why was he discharged the same day? Are they lying to us that he was discharged the same day? And why was it that man I was looking at should not have been discharged the same day?
I don't think we should go there. We don't know what the case is.
No, it doesn't matter. It doesn't matter. A patient has head injury. The reason why they
what
said
if it's ordinary bruise?
no, you don't get. Once you see a patient like that, depressed level of consciousness and a big wound on his head, you will observe for 24 hours. It's standard procedure.
Okay.
So these are the questions. Why they only saying they discharge the man immediately just for us to know, just for us to think that
everything went well?
Everything went well. It wasn't a big deal. That's not the point. It's not for you to try and prove to us that thing was not a big deal. It was just something we just sutured his head and he left. No, so we shouldn't try and trivialize things like that. All right. So, like we said, I don't see any other place on the internet where you will find this kind of unbiased analysis. If there's any other place, tag me. Yes.
All right.
Okay. So.
Life is precious. Let's guard it jealously.
Yeah, look out for other reviews.
And may God help Nigeria. May God help our government.
Amen.
Amen.